Welcome to the BMAT Champion Training. This is intended as a train the trainer for those instructing on the Bedside Mobility Assessment Tool. By training nurses who have a baseline understanding of the unique patient population challenges, you will be setting up each department for BMAT implementation success. As you're developing your training curriculum, I recommend that you consider including these recommendations. Prior to class, make sure that all of your trainers have a basic understanding of BMAT. This can be accomplished through a free BMAT learning video. Next, make sure that all of your trainers are up to date on their safe patient handling and mobility equipment proficiencies. I recommend beginning your class with the BMAT basics to ensure that everyone is on the same page. Once your trainers have an understanding of the basic 4 steps, it is important that they understand the purpose behind each function in each level. Now, once you have taught how to perform the BMAT and what the purpose of each level is, next, you should begin your critical thinking scenarios. I recommend breaking up your group of nurses into groups of 3 so they can all work together, then separating the scenarios into patient population challenges and nursing considerations. Finally, I recommend completing a BMAT skills checklist with each trainer. This will not only document their competency, it also demonstrates proper procedures for checking off a nurse for a BMAT skills check. Finally, be sure to include any facility-specific BMAT implementation information that your trainers would need to know. Here are some tips before you begin teaching. I always recommend to demonstrate and require return demonstration. Always encourage nursing to integrate this into their daily head-to-toe assessment. That way it's not so overwhelming. And remember, the BMAT should be performed every shift and as needed, including after a patient falls or there is any change in their mobility status. Additionally, remind the nurses that nursing assistants and techs should be encouraged to ask for a reassessment if the results do not align with the patient's ability. Nurses should be encouraged to ask for assistance from PTs and OTs if there's a question about the results. And the nurses must understand the intention of each step so that they can really critically think about the assessment. Let's begin with assessment level 1, sit and shake. We ask the patient to come from a semi-reclined position in bed independently to sitting on the edge of bed. Then, reach across midline to shake the nurse's hand. Before we move on with the BMAT, let's discuss some nursing assessment opportunities as we encourage the nurses to integrate their head-to-toe assessment. Nurses can easily look for pupil reaction, lymph node enlargement, test for grip strength, check for radial and pedal pulses, look for dependent edema, and listen to lung and heart sounds. These can all be achieved easily in the position the patient is seated in. In order to perform assessment level 1, the nurse will ask the patient to come to a seated position at the edge of bed. The nurse will demonstrate the activity but does not offer any manual assistance. Finally, the nurse extends her hand, forcing the patient to reach across midline to shake. During assessment level 1, we measure a patient's ability to come to a sitting position independently. We measure a patient's core strength or ability to sit unsupported, and we measure proprioception or sitting balance. Crossing midline during the shake challenges right to left brain communication. Now let's discuss some challenges if the patient has cognitive impairment, dementia, confusion, or special needs. For these patients, we want to consider some alternative techniques to achieve the same assessment results. Consider handing a patient water or a belonging, forcing them to cross midline. If medication is due, medication administration could be used to measure a patient's ability to reach across midline. For the pediatric population, asking a patient to shake hands may be awkward for them. Include something fun, like a high five, or asking the patient to point at something across the room. If your patient is unable to complete the tasks of assessment level 1, he or she is considered mobility level 1. Mobility level 1 safe patient handling equipment includes ceiling lifts, mobile lifts, slings, transfer chairs, slide sheets, and air-assisted lateral transfer devices. Find out what is available at your facility and ensure all the bedside caregivers are competent in use. If your patient successfully completes all of the tasks of assessment level 1, move on to assessment level 2, stretch and point. Again, before you begin teaching this level, Engage your nurses in thinking of nursing assessment opportunities, like listening to bowel sounds and assessing the skin on the feet and toes. When performing assessment level 2, I encourage you to teach the nurse to demonstrate the activity to the patient so the patient has a clearer understanding of what it is they are being asked to perform. Remember when teaching this assessment level that we only need to measure the leg or legs the patient intends to stand on. If, for example, the patient has an immobilizer or a unilateral amputation, only measure the leg the patient intends to bear weight on. If the patient is unable to complete the steps of assessment level 2, he or she is considered mobility level 2 or two-person assist. However, please encourage the use of safe patient handling equipment to avoid unsafe two-person transfers. The primary equipment for mobility level 2 is the mechanical sit-to-stand. However, the slide sheet and air-assisted lateral transfer device could still be useful. Include your safe patient handling equipment in your BMAT training and ensure that all caregivers are competent in use. If your patient completes assessment level 2 successfully, move on to assessment level 3. Stand. When teaching assessment level 3, remind the nurses to get any assistive equipment needed by the patient before performing this assessment level. In addition, it's important that the patient assessment level 3 occurs at the side of the bed so that if the patient were to become unstable, we could easily and safely guide them back to a seated position on the bed. Okay, another opportunity to engage your students. Ask the nurses about what assessment opportunities they think of when performing assessment level 3. One of the best is a skin assessment for at-risk pressure areas. With a patient in a standing position, you can easily peek at their sacrum and coccyx area to see if there are any developing pressure sores. In addition, we can measure orthostatic intolerance, dizziness, or any balance issues that the patient reports upon standing. For this assessment level, remind the nurse to stay in front of the patient to ensure safety. Then, ask the patient to stand for a count of 5. The high five is optional. If your patient is unable to achieve an independent stand for a full 5 seconds, he or she is mobility level 3. This is also referred to as minimal assist, one-person assist, or contact guard. But remember to encourage the use of safe patient handling equipment to avoid unsafe manual handling. Mobility level 3 equipment includes non-powered stand aids, slide sheets, and therapy equipment like walkers, canes, and crutches. It also includes hybrid equipment like this safety platform walker, helpful for therapy and safe patient handling. Include your mobility level 3 equipment in your BMAT training and ensure that all teachers are competent in use. If the patient successfully completes all the tasks of assessment level 3 or stand, proceed to assessment level 4 or walk. During assessment level 4, we are measuring pre-walking activities, inspired to us by the egress test. Weight shifts allow a patient to practice walking activities while staying safe and close to the bed. If a patient is unable to return to their back foot during the weight shift, and we commonly see this with neuro issues, guide the patient to the back leg and return to a sitting position on the edge of bed. Allow the patient to use a walker if that is typical for the patient. With assessment level 4, the nurse should demonstrate the activity for the patient first. Then ask the patient to march in place, just enough to clear their feet from the floor. Next, we ask the patient to step forward and back, and then repeat with the other leg. Demonstrating first is also very helpful for the patient. So this is where the BMAT can be a little bit difficult to understand. With every assessment level so far, if the patient fails to complete the tasks, he or she is considered that same mobility level. However, when you get to assessment level 4, if the patient passes, he is mobility level 4. If they fail or are unable to complete the tasks, they back up to mobility level 3. The intention here is that when a patient is unable to demonstrate safe walking activity independently, we want to ensure that they have mobility assistance or mobility devices available to keep them safe from falling. I also recommend that you always consult with physical and occupational therapy to ensure these patients are receiving services. If the patient is unable to complete the tasks of assessment level 4 and is considered mobility level 3, I would suggest consulting with physical or occupational therapy regarding the appropriate equipment for this patient to use, perhaps a walker or another assistive device. In addition, even if a patient passes assessment level 4 but uses a walker, cane, or crutches, we want them to be considered mobility level 3. That is because even though the patient is independent, if their device is not closely accessible, they are not independent, and we want to alert the staff to the need for assistive equipment. If your patient is able to successfully complete assessment level 4, he or she is considered mobility level 4. This is considered independent, modified independent, or supervision. When educating on mobility level 4, be sure to include facility-specific protocols like call, don't fall, or other policies that require a caregiver to be present when a patient moves or mobilizes. Independent can mean very different things at every facility. Be sure to check with your facility about specific rules and protocols. If the patient is considered mobility level 4, even though it is not an official part of the BMAT, I always recommend taking the patient a few steps away and back from the bed, just to be sure. After the assessment is complete, you'll want to teach the nurses to document and communicate the results. First, document the BMAT score, either in the electronic health record or following whatever process your facility has implemented. Next, communicating the results is so important. Be sure to include in your training the specific communication methods or signage your facility has chosen. Talk about whose responsibility it is to post and update the signs, and the importance of having up-to-date, accurate BMAT levels posted to ensure both caregiver and patient safety. Finally, encourage collaboration between PT, OT, and nursing to ensure the patient has the best safe patient handling and mobility transfer method. Empower your nursing assistants and techs that when they are in doubt of the patient's abilities based on the BMAT level, that they should always default to the safest method of transfer and ask the nurse to reassess the patient's mobility. I am often asked why a nurse must perform the BMAT, and the answer is critical thinking. Some organizations actually require the RN to perform the physical assessment, while other organizations allow the nursing assistant to do the data collection or walk through the steps of the BMAT with the patient. However, the nurse must take the results of the BMAT assessment and combine it with the patient as a whole to make the determination about the best method of transport or transfer or mobility for a patient. Next, let's discuss those difficult patient populations that make performing the BMAT in the standard 4 steps a little bit difficult for some of these patients. This also requires critical thinking from the nurse. We will go over some of the techniques used to properly perform the BMAT, modifying some of the actions in order to accommodate these special patient populations. Conditions such as orthostatic intolerance, dizziness, high fall risk, bleeding risks from blood thinners, instability or reactions to strong medication, environmental tripping hazards, and other factors must be considered. Even if a patient passes assessment level 4, the nurse may determine that level 3 is more appropriate for safety. Ask your nurses what other considerations they can think of. First is the person of size. Depending on the patient's body morphology, abdominal girth may present issues for a patient getting their nose over toes and having the ability to stand in the typical way. It is always best to start by discussing with this patient what their normal method is for getting up and out of bed. Some of the methods commonly seen involve using a grab bar or maybe the bed rails to get the patient to stand up. Some patients may rock back and forth in order to gain momentum to stand. Regardless of the method used, ensure safety and discuss what method will be used before the patient attempts to stand. During your BMAT training, I always suggest role-playing the BMAT assessment with these patient population-specific considerations. This will give your students the chance to have the discussion with the patient and to critically think through a solution. Next, let's discuss the patient who has undergone a sternotomy and has sternal precautions. Oftentimes, these patients can stand and walk independently, but need assistance to come to a sitting position. Techniques for these patients include mimicking what physical therapy has been teaching the patient with a roll then sit method where the patient is able to push down on their elbow and sit up. If they are still too weak for this method, utilize your bed controls, sitting your bed all the way up and allowing the patient to use the bed to steady themselves. Finally, consult with physical therapy. They may have some ideas on how to encourage the patient to sit on their own. Next, we will discuss the hip precautions, specifically with a posterior hip replacement. These patients must maintain a greater than 90-degree hip angle in order to prevent hip dislocation. This may require a modified approach for assessment level 3, stand. Consider using the bed rails or lifting the base height of the bed to a higher level in order to prevent the patient from having to lean forward before standing. In addition, an assistive device like a walker may be required. This is a great opportunity to collaborate with physical therapy to determine the safest method to assess a patient's ability to stand. Finally, we will discuss the cognitively impaired patient. This includes confused patients and patients with dementia. Some specific ideas for how to accommodate these patients was already discussed in Assessment Level 1. If these methods are not successful, you may need to consult with PT or OT to help collaborate on determining a BMAT level. Teaching BMAT, ensure that you have dedicated time for demonstration to ensure that the nurses properly understand how to perform the BMAT. By encouraging group learning, each member of the group can take turns performing the BMAT, and they can be there to offer helpful hints in case one person forgets a step. Including simulation training in your BMAT class is just as important as it is for any other task that involves critical thinking. Have some scenarios prepared that include some of the challenges that we discussed with those unique patient populations. Once your students have mastered the basics of the BMAT, then you can move on to these scenarios, which will help challenge critical thinking for these unusual or difficult circumstances that they might encounter. It is also important to include nursing scenarios that require critical thinking and clinical judgment involving the BMAT. For example, your scenarios could include a patient with a high lab INR value indicating a high bleeding risk, a patient who reports a new onset of dizziness, or a patient with excessive lines and tubes that may present an environmental tripping risk. You would start by describing the patient's medical condition. Your participant, who is role-playing as the patient, would pass all levels of the assessment. The goal of this portion of the scenario would be for the nurse to indicate that either mobility level 4 is not safe and mobility level 3 is more appropriate, or that the nurse indicates he or she would prefer to collaborate with physical therapy to determine a safe method of transfer. That's it. Your nurses should be ready to start training on BMAT. Thank you for listening, and I hope you found this BMAT Champion training helpful. This is Amber Perez, Clinical Director for East Medical. If you have any BMAT-related questions, please feel free to email me at bmatnurse@gmail.com. This free education was sponsored by East Medical. Please stick around for a minute and learn about some of the innovative devices that can help enhance your safe patient handling program. The Denali 600 is a